Okay, so let's talk about the nutrition portion of sciatica. Now, because sciatica is from a pinched nerve, you want to be consuming foods that are anti-inflammatory. And the first things you want to stop doing, and it's not forever, it's just for a few days until you start to feel better, is you definitely want to reduce salt. Because salt does what? When you eat salty foods, your rings and your fingers get tight. So you want to reduce salt because salt makes you retain water, causes swelling. Same with sugar. So sugar has to come way down. Sugar is also in things like carbohydrates, like all your pastas, right, and breads. Those convert to sugar in your body when you digest them, and that's going to cause more inflammation and pain. So you want to reduce your carbohydrates, your sugar, and salt. That also goes along with things like alcohol. You're drinking alcohol has some antioxidants, does dilate the blood vessels, but it does massively increase inflammation. You're going to have more pain. Smoking cigarettes causes more inflammation. And these things, I'm not saying forever. Ideally, if you were smoking, you would want to stop anyways. But I'm not saying stop all these things for the rest of your life. It's just until you start to feel better. You want to get the healing going. You want to reduce inflammation. Those are things that are really going to slow it down. What you want to concentrate on food-wise, for the first 5 or 7 days, or until you start to feel much better, you want to be hitting or consuming lots of fruits and salads. And so fruits would be like your apples, your bananas, your pears, your cherries. And these are all not canned, but these are live foods. These are fresh. And so fruits, and then your salads, lots of greens, leafy salads. Lots of salads and greens, not iceberg salads, but fresh greens. You can get that like packet of all different types of lettuces in there. And greens, you want to be doing that 3 times a day with greens and fruits. I would recommend juicing. Like we have patients that do juicing of celeries, carrots, cucumbers, kale, a little bit of apple to sweeten it, and they drink that twice a day. So what you're doing is you're getting antioxidants. You're getting those greens inside you. That reduces inflammation, promotes healing, shrinks any of the swelling down, because what's happening is swollen disc, everything is swollen there. So you're reducing sugar, you're reducing salt, you're increasing your greens, pressure is taking off that nerve. So lean proteins, you can do salmon, omega-3s, chicken, and those you don't want to fry them, you want to have them just maybe grilled. And for a grain right now, I would do brown rice. So brown rice, for a meal you may have some brown rice, use some sweet potatoes, lean proteins, very lean, maybe piece of steak. You could do a lean piece of chicken or preferably fish, and a nice big salad. The last thing is water. Water is huge. You should be consuming half your body weight in ounces of water. Okay, not pounds, but ounces. So if I weigh 150 pounds, I'm drinking 75 ounces of water. So you want to be drinking tons of water. Why? To flush out inflammation caused from that pinched nerve. And it also starts to shrink that swollen disc. Okay? Supplements, additionally, that do help, and you can get these at any health food store. Preferably go to a reputable place instead of Walmart. But you want to be doing vitamin C. You can do powder, which is easier, or tablets. And the powder, I usually tell patients about 2,000 milligrams per day, okay, unless there's any contraindications in the medications you're taking, but usually there isn't. You can ask your doctor. But vitamin C, why? Promotes healing, reduces inflammation. B complex, you want to pick up a B complex vitamin. B complex, any B vitamins help with nerve pain. Any kind of compression or damage to the nerve, this is going to help. So pick up a B complex, follow the instructions on there. And then lastly is any omega-3s, fish oils. A lot of Americans don't eat fish. If you're consuming a ton of fish every day, you don't need to take this. But I would take 2 omega-3s. Those are fish oils. Just ask for, if you don't know what to ask for at the health food store, say, hey, my doctor or watch this video and he recommended to take omega-3s. Take 2 of these a day. All right, those are the supplements that really help. So that's the nutrition, once again, the important, which is so important. A lot of people miss this and they wonder why they're not improving. your water, you're decreasing salt, your sugar, your carbohydrates, you're throwing out alcohol for a little while, you're smoking, increasing massive amounts of live food, greens, salads, lean proteins, fresh fruits. That water is super important, and that's a big portion, so really follow along with this, and then you can start to introduce your old diet a little bit as you're starting to feel better, but I wouldn't hit any of your old diet until you start feeling great, okay? We'll talk to you soon. Now watch the next video.